welcome to our Facebook Live. This one is on insurance questions, frequently asked questions. So the insurance piece is a big part of my practice because we do something that is pretty rare, not commonly done, and so insurance companies don't necessarily know all the ins and outs of microtia ear reconstruction with the PIER method, porous implant ear reconstruction. So we wanted to just help families understand a little bit how we've modified our practice basically to help you deal with all the issues that come up with insurance. So we got a few questions. I'm going to go over some of those, but also wanted to give you a little background why this is kind of an important topic. Obviously, traveling to have surgery is very expensive. You pay your premiums to your insurance company. You expect and hope that they're going to pay for your child's surgery if it's necessary. A few years ago, I'd say about 3 years ago, I started getting concerned that maybe insurance companies might look at my kids, my patient kids, as though this was cosmetic surgery, which is absolutely not the case. And it turns out a federal statute to protect that right didn't get passed, but there are state statutes that I started researching that protect children that are born with a congenital birth defect to get reconstructive surgery, that it has to be covered by insurance. So I got interested in learning more about that and did a lot of research several years ago, talked to a lot of consultants, even hired at my own expense lawyers to help me figure out what are the laws and what are these insurance companies supposed to do, and then how do we get them to do what they're supposed to do. So over the past 3 years, we've sort of put a lot of effort and work into this, and now we're sort of at a very wonderful place because we got to a point where we've made great strides in getting these cases covered by me with your insurance and seeing me as an in-network doctor. So I want to kind of tell you how that process works. Basically, we have a team that is assembled to help walk families through this process. There's like a billing component team, a legal component team, a patient advocacy team, my team, and then we all communicate with your insurance company and you to get this process underway. And what we've discovered is when we can explain to your insurance company that there is almost certainly no doctor close to you or local to you that is in your network that can perform this operation, once we can convince them, then they are able to say, okay, even though Dr. Lewin is an out-of-network surgeon, we will consider her in network. So one of the questions that we get is, why is it so difficult to get a clear answer about insurance coverage for PIER surgery? And it's because we really have to individualize every single kid or every single family to their particular policy. So 10 people that have Blue Cross, Blue Shield, Aetna, or whatever, each policy is going to be completely different. So that's why we've needed this team, and the team looks at your plan and develops a strategy for how to explain this to your insurance company. So one of the questions we got is, does Dr. Lewin's practice accept insurance? And we have noted, as much as we love social media, that we have seen many times a lot of misinformation out on social media with respect to my practice. And the truth is, we work with all insurance companies. That includes HMOs, EPOs, POSs, PPOs, every kind of acronym you can think of. We have had a kid covered with that type of insurance. And it's just this, long explanation process that we have to make sure your insurance company understands why we are considered in network, because we are so specialized. And the way that your insurance company looks at it is, if your, let's say, HMO doesn't have a specialist who can reconstruct your ear with a porous implant, they have a sort of a statute in their policy that says, well, if we can't provide a service, then there's an alternate route that you can take for your insurance company to go to another provider that's not a network, and they can provide that service for us. Because obviously one HMO can't provide every service. So the way that we would get that covered is we would be seen as in-network through what we call a gap exception. That's because there's a gap in their coverage for you, and we get an exception and that's what makes me seen in network. So what's really exciting, I mean, probably the best news, is that we looked back on our last year of all of our U.S. cases, United States-based cases that have insurance, and we discovered 3 out of every 4 children are seeing me as an in-network doctor. And the reason that's important is you probably didn't think you could come here and only have to pay your, sorry, there's someone at the door.
Welcome to Facebook Live.
Anyways, the point being that we are able to get 3 out of 4 kids covered with just paying your in-network deductible, in-network co-insurance, and in-network max out-of-pocket. There's sort of 3 fees that are involved. So that's been actually incredible news, because if you looked at my practice 3 years ago, I'd say more than 3 out of 4 were out-of-network only. Out-of-network almost always has a higher deductible, a higher co-insurance, and a higher out-of-pocket. So the parents' portion or the family's portion of the cost of surgery is much higher if you go out-of-network. Now, if you did not get this exception, that 4th person, they still get surgery, but they are seen as out-of-network. So they do have to pay that higher share of the cost. Another really good question, and I don't know the ins and outs of why the answer to this is true, but I can just tell you my own experience within my practice. But the question is a BAHA device typically covered by insurance during microtia ear reconstruction? And the answer is almost always. When we're applying for authorization for your ear surgery, we also authorize the BAHA at the same exact time and make a justification for why your child who has a conductive hearing loss would need the BAHA. And we say we can do both surgeries in the same anesthesia, same time, and we almost always get approval. So even if you did not get the BAHA covered by your insurance on the soft band, our experience here is 90% of the time, if you are surgically implanting for the BAHA, the processor gets covered with it. So I think that's exciting. I guess the exceptions, the couple times that it hasn't worked, has been for a policy that writes in a strict exclusion to those services. And we look at your policy and tell you if you have that exclusion, and you will at least know right at the get-go whether that's true. Another question, how do I know if my health insurance plan covers the PIER surgery, and what would my steps be? So we have this process very well worked out, and it's a process, I will tell you. Each step along the way, we may need something from you, and we need to give something to you, and it's like a back and forth. But it really just starts by filling out our Contact Us form on our website. And once we get that form, we get more information about your child. We'll ask for photographs. And ultimately, what's been extremely valuable is we have a phone conversation or Skype conversation with any patient interested. There is no fee involved. But it allows me to ask you very specific questions about your child's medical history, needs, answer all of your questions, all of those things. But it also, at that same time, allows me to construct a letter to your insurance company that documents all the information about your child and why this is not considered a cosmetic surgery, it's a reconstructive surgery, this is why you need to cover it, etc. And we don't really take no for an answer very easily. I will tell you, we have appealed, we have a right to appeal, there's multiple layers of steps we can do to fight for a kid to get their surgery. I talk to medical directors, I have peer-to-peer conversations, different kind of peer, but peer-to-peer conversations with medical directors of the insurance company explaining why your child needs this surgery and that it should be covered. So those are some of the questions we got on our that people had asked us about, and if there's, I don't know if there's any other questions.
Yeah, one thing, do you want to explain that this is actually just for United States-based patients and
this
policies?
Is true. We have had very good success with our United States patients. We have had not good success, I will tell you, with international insurances. That we have never gotten one of those to pay for the surgery before. I have just a handful of patients who have gotten their own insurance to reimburse them after surgery, So that's the process we do if you are an international patient with international insurance.
And if somebody had commented asking about their specific insurance company and if you cover it, do you want to explain how everything's individual?
Oh, yes, absolutely. So this insurance world, I am no expert, and sort of just by necessity have had to learn some of this, but it is somewhat incredibly complicated to deal with because there's no one right answer or one path that anybody's going to go on. So as I was sort of starting to explain earlier, it's not that we do or don't take any particular insurance. We have examples of taking just about every insurance out there. We even had one state insurance cover a child. I mean, exceptional. Like, I don't know, it was a long fight, but we got one child covered that way. So it's more that everything is just depending on what your particular policy is. So there's just no policy that's the same as any other. So comparing, I have Aetna, it covered 90% of my surgery. I was very happy versus I have Aetna, the same thing should happen. It doesn't really work that way. But part of the reason we have this team, after you decide you want surgery and I deem that you're healthy and ready for surgery, the next step along the process is a team financial discussion where we kind of look at your specific policy. You send it to us and we can go through it and see exactly what it says and explain that to you.
Great. I just want to have a couple of shout outs to some of your fans who are following the Aaliyah Bancher family.
Hello, Aaliyah.
Benjamin Boss says hi and
Hi,
actually
Ben.
says that the team is excellent at the insurance process.
Thank you.
The Madison family, Aiden Day, the Sappingtons say hello. We will see them in Dallas.
See you in Dallas.
Yes, everybody come to the meet and greet in Dallas. I think Austin is sold out. Come to Dallas, November 9th. Microtia Awareness Day.
Microtia Awareness Day, November 9th. Be there, Texas.
Campius family. They say hi,
Mason.
Dr. Lewin. The Amanda Fletcher says it's super helpful information. That's good news.
Awesome.
Sanders family, they're looking forward to getting this process started for surgery. A lot of families following from Colombia, Bermuda,
Wow.
family. So lots of
Fantastic.
fun. Oh, look at Max and Hess says hello,
Oh,
Vegas. And the
hello.
Sappingtons all in caps. We can't wait to see you guys.
Thank
That's
you
cute.
guys. Thanks so much for tuning into our Facebook Live. We really appreciate it. We really want to help every single kid out there that wants help. So just contact us.
And do you want to talk about the flyer and about our new newsletter to sign up?
Oh, yes. I do have, we have a little handout that we've prepared to make this easier to understand, probably easier than my Facebook Live. If you want to get a copy of this insurance FAQ for PIER surgery, just email us at info@lewinmd.com. We'll send you everything you need.
And people say greetings from Mexico.
Greetings to Mexico.
Adios.
Adios. Bye-bye, guys. Thanks so much.